Hai, Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, let me introduce myself. My name is Ahmad Widat Alan Anwari and I'm from class 2A. Okay, in this video, I want to presentation the material conclusion from the first meeting to the 15th meeting. Before that, hi Nizi, how are you? I hope you always be happy and be healthy. Okay, let's move on to first material. Well, in the first material, we learn about admitting patient. In this material, we learn to read dialogue and practice how to receive patient and also create new dialogue. In this dialogue, explains the procedure for receiving patient, such as for example, receiving patient at the registration table. The patient is asked and directed to take a kitchen number and wait. Then fill out the form and then directed to general folly. Okay, next to second material, still same, namely admitting patient. In this material, we watch a sample dialogue in patient acceptance and then we practice the same dialogue as the example in the video with our friend. We learn to understand the procedure and can apply patient acceptance. For example, in the video, we learn about admitting patient who will be on X-ray. The nurse asks for a medical history, allergic experience by the patient and the accompanying family. Okay, after that, the third material is caring after an operating. This is post-operative care. In this material, we learn to read and write about post-operative care. It can be concluded that post-operative care is the care received after surgical procedure. Their treatment often include pain management and wound care. Post-operative care is started immediately after surgery. As long as the patient stays in the hospital and can continue after discharge with the aim of reducing the risk of complication after surgery and supporting the patient recovery process. Okay, next to the fourth material is still about the caring after an operating post-operative care. In this material, we learn by watching video about post-operative care in the post-anesthesia care unit or PACU. In the video, it is explained that the PACU nurse performed an immediate assessment to the patient airway, respiratory and circulatory status, and focus and more thorough assessment. There are three phases of post-anesthesia care. First one is the immediate post-anesthesia period, when the patient is emerging from anesthesia and requests one-on-one care. Phase 2 is continued recovery, when the patient consciousness return to baseline and the patient has stable pulmonary, cardiac, and renal functioning. And phase 3 is ongoing care for patients needing extended observation and intervention after phase 1 or 2, such as 23 hours observation unit or in hospital unit. The nurse should be assessed and document respiratory, circulatory, and neurologic function frequently. Okay, we next to Fifth material is about caring terminally ill patient. In this material, we learn to read and write about caring terminally ill patient. In this material, we explain how we can help terminally ill patient. The first aid, the psychological and spiritual coping process. The consultant can engage in discussion that allow the patient to reveal the important physiological, social, and spiritual aspect in his or her life. The consultant may ask about some the following life story: relationship, coping spiritually. The second is the assess and treat physically illness. The third is to maximize comfort. And the fourth, treatment and support from family. Okay, next is the sick material, caring terminally ill patient. In this material, we learn to listen and write about caring terminally ill patient. In this video, describe about first, define loss. Loss can be defined as the undesired change or removal of a valued object, person, or situation. Second, define grief. Grief is the physical, psychological, and spiritual response to loss. Third, euthanasia. Euthanasia literally means good fit. The word euthanasia is defined at the edge or practice of pointlessly putting to death or withdrawing treatment from a person suffering in an incurable disease. Let us continue to the second material, namely the district nurse. In this material, we learn about district nurse, so that we know the function and understanding and duties of district nurse. District nurse are registered general nurse who administer care in community, especially trained in community healthcare. District nurse care for patients who are at home. They make house visit to patients. During this home visit, the district nurse has a number of responsibilities, including wound management, medical support, rehabilitation assistance, and catheter care. A district nurse should also identify any major health care needs and discuss them with the individual, their family, or carers. Third, the district nurse can act as a teacher. This is managing knowledge about various aspects of health. Okay, next we to material 9. We learn about district nurse. We learn through listening audio about nursing, and also we watch video on YouTube about district nurse. Also, we learn writing. District nurse visit the homes of the people who cannot leave the house for various reasons, being their final needs, or they are simply unable to leave to the house on their own because of a disability. So, the district nurse visits them and gives them medicine or many others. Next to the 10 material, In this material, we learn about helping patients with rehabilitation. We learn by reading and writing about helping patients with rehabilitation. Rehabilitation nurse provide care that helps to restore and maintain function and prevent complications. They also provide patient and family education, counseling, and case management. Rehabilitation nurses serve as patient and family advocates and also participate in research that helps improve the practice of rehabilitation. Rehabilitation nurses may practice in variety of settings, including hospital, inpatient rehabilitation center, outpatient rehabilitation center, long-term care facilities, community and home healthing setting, and others. Okay, we'll be next to 11 material about helping patients with rehabilitation. In this material, we watch videos about helping patients with rehabilitation. In this video, describe an example of the application of helping patients with rehabilitation. And the rehabilitation nurse must be aware of the patient diagnosis and its potential. The rehabilitation nurse must use skill, judgment, and critical thinking. Next to 12 material, we discuss mobilizing patient. Mobilizing patient itself is a nurse activity in helping patient to mobilize. In the video that Ms. Z shared with us, the video explains the stake in patient mobilization. We can understand the way and step in moving patient or mobilizing patient. Next to the 13 material, we discuss medical imaging. We read, listen to videos, and explain the conclusion we have made from the videos we have watched. Medical imaging is a technologist are an important part of treatment because a technologist is a part of diagnostic and planning process in treatment. Technologists aim to confirm the correct diagnosis and provide the correct dosage for their procedure. What a technology does really drives their decision made regarding patient care as well as whether the patient is in remission or whether the problem at hand has been treated effectively. Okay, next to 14 material about helping patients with diabetes management. We learn about the procedure for handling diabetes patient or helping patient with diabetes management. We read the text related to helping patient with diabetes management and then summarize it. Diabetes management daily routine affect blood sugar. Diabetes management requires awareness, but if you have diabetes, you need to know how food affects your blood sugar level because food affects blood sugar level. Exercise and also control your blood sugar level. Talk to your doctor for intensity of exercise. Drink a lot of water or other fluid while exercising. Okay. Next material and this closing the material is about helping patient with diabetes management. We learn about the procedure for handling diabetes patient. We learn through watching and listening to video about handling diabetes patient. And in this video, it explains what diabetes, treatment and management of diabetes, nutrition and diet, how to make food for patient diabetes, and physical activity. Okay, this is my presentation from first material to 15 material.